Hi, this is Dr. Daniel Ronel. You're listening to Talk 1260 KTRC Western Medicine. I'm a board-certified plastic surgeon, and I have a great guest here today, one of my favorite anesthesiologists, Dr. Les Garson, also a board-certified anesthesiologist over at the Physicians Plaza Surgery Center, which is where I do most of my surgeries. And today we're going to talk about post-operative, after the operation, pain and nausea, because it's a thing that everybody's worried about. What are your thoughts on that?
Well, that's a good question, Dan, and you're right. That's a common concern that patients have when we talk to them preoperatively before the surgery starts. And I'll tell you a little bit about some of my strategies and some of the things we do during the surgery to help make the patient's postoperative course as comfortable and pain-free as possible. One thing that's always been kind of a particular interest of mine is the use of semantics in medicine, the words we use. And things that I try to talk to and say to patients before we even begin the anesthetic is I tell them that I'm going to give them medication to keep them comfortable when they wake up, to keep their stomach comfortable when they wake up. I do not use words like nausea, vomiting, pain, words that have negative connotations.
Okay.
So we don't set the patient up to start thinking that that's going to happen when they wake up.
Right, right.
The things we do in surgery, which you actually help us do and have been a tremendous advocate for, is keeping the patients warm.
Yeah.
We found that patients heal better, their immune system works better, their blood clots better, and they're more comfortable when they wake up in the recovery room, when their body temperature is normal.
Right.
So we go to extreme lengths during the surgery to keep the patients warm and comfortable so that when they wake up in the recovery room, they're not shivering, they're not cold, and they don't have that sense of discomfort.
Yeah, I know a lot of surgeons like to keep the room very cold because we're wearing gowns and hats and masks, and so we sweat. But I've learned from my pediatrics that you have to keep the room temperature up, and I usually ask people to turn the temperature up because it helps postoperative recovery, and it clearly decreases postoperative wound infections.
Exactly.
So, yeah. You know, I give most of my patients their narcotics afterwards, Vicodin, Percocet. You know, they're not going to get addicted from it.
Absolutely. Yeah, exactly. Again, that's a concern patients have. Oh, if I take these narcotics post-operatively, will I become an addict? You hear that often. That's very untrue. Narcotics used for post-operative acute pain are very effective, they work great, and chances of any kind of addiction are virtually nil.
Yeah, and there's other things out there too, though.
Absolutely. Non-steroidal anti-inflammatories work great. There's intravenous drugs we use that work that way. Of course, drugs that people are familiar with, like Motrin, naproxen, are also...
I usually tell my patients not to take that right after surgery because it can lead to increased bleeding sometimes. But certainly after a week or so, you know, you want to get off the narcotics because they make you feel funny. Definitely I switch them over. Something else that's really important to me is the preoperative acupuncture that my patients get clearly has been proven to decrease pain and nausea after the surgery, and I love offering that to them because it's very important.
Absolutely, I agree. I think acupuncture is a wonderful adjunct, and as I always like to say, something that's been used for 5,000 years obviously has some
absolutely, yeah, absolutely. You're listening to Talk 1260 KTRC, Dr. Daniel Ronel.
Can I just say one thing?
Yes.
I want to interrupt. What I just am always touched by, and this is why probably I married a doctor, is the care. Listen to these two individuals here. Each of them I want to get Senator Garson's face, exquisitely trained, and they're just talking. Listen to the care and the attention that these two individual people, they're just two humans like the rest of us, but there's so much care and thought and just concern that goes in to the services they provide us as human beings, as their patients. It just always moves me when I hear excellent doctors, not the average Joe who screws things up for the rest of the doctors in the world, but the excellent doctors, the top-notch trained doctors. When I hear them talk about the care that they want to give their patients and their fellow human beings, It just moves me to no end. So God bless both of you and all the very best doctors out there that have been well trained, who have the ultimate care and concern for their fellow human being.
All right, all right.
That's it.
Thank
All
you.
right, here, here. Well, this is Talk 1260 KTRC, Western Medicine. I'm Dr. Daniel Ronel. That was my wife, Betsy Ronel. We're here with our guest, Les Garson, board-certified anesthesiologist at the Physicians Plaza Surgery Center, also at St. Vincent Hospital. Thank you very much for coming.
Thank you.
Thank you.
I'm sorry.